For the first test of hip internal and external rotation, we'll have the patient in prone, as this position will stabilise the hips and the legs are not moving against gravity compared to the sitting position. So we're going to start with internal rotation, so the patient to bend their knees to 90 degrees, and then a passive fall out, and then we can measure and compare both sides. So measure against the vertical and the line of the tibia, and then we'll compare both sides. For external rotation, back to 90 degrees, we'll just do one leg at a time, and then I'll get the patient to move this leg across the midline, ensuring that their pelvis stays nice and flat, and then once again measuring against the vertical and the line of the tibia. So the knee to wall test or dorsiflexion lunge is set up with the patient up against the wall and a tape measure next to them. The patient, when instructed, will lunge forward, ensuring their heel stays on the ground. Good. And they can come back and then slowly move back until the point where their heel just comes off the ground. So we'll go again, we'll go to the next one. Good, so our heel just started to come off there. So we're looking at about 9 centimetres on this left leg, and then we compare across both sides, and a score of greater than 1.5 centimetre asymmetry on both sides may indicate a likely increased risk of injury. So the next test is the 6 metre hop test, where I'll get you to hop on one leg across the 6 metre walkway as fast as you can, and I'll be timing you across that time. A time difference of greater than 15% compared to your left and your right is an indicator of a higher risk of injury. If at any time during the test you lose your balance, the test will be repeated. So when the participant's ready, we'll get them to hop across as fast as they can and go. The next test is the side plank or lateral bridge endurance test, where the participant will begin in the side plank position with legs on top of each other, shoulder underneath, elbow at 90 degrees and the top arm on top. They will lift up, maintaining a neutral spine. The test will terminate when there is loss of form or fatigue. The next test is the single leg bridge endurance test, where the participant will begin with their leg up on a 60 centimetre box or plinth, knee approximately in 20 degrees of flexion, and then their non-testing leg will be in 90 degrees knee flexion. When ready, the participant will perform a bridge going into full hip extension and down, and continue with repetitions until fatigue or loss of form. Less than 5 bridges on either side, or an asymmetry of greater than 10, may indicate a higher risk of injury. The next test is the Y balance lower quarter test. To begin, a Y has been constructed out of tape along the ground. The next step is the participant's leg length will be measured from the point of the ASIS down to the medial malleolus. During the test, the participant will step forward to the centre of the Y with their supporting leg, and then when I ask you to do so, you'll reach forward with your testing leg as far as you can, ensuring it does not touch the ground, and then coming back to the starting position without losing your balance. So I'll get you to do that now with your right leg. So reaching forward, good, and coming back. The distance is marked, and the participant will have 3 tries to get an average, which will then be calculated as a percentage of leg length. The other 2 directions for this test are posterior medial, which the participant will move their leg back and across the midline of the body, and posterior lateral, which is back and away from the body. Good. The test will be completed with 3 trials on the right side, then 3 trials on the left side, in each of those directions in that order. The final test is the closed kinetic chain upper extremity stability test, where the participant will have their hands marked out at 36 inches apart. They will lift one hand and reach over and touch their supporting hand, and then alternate between sides. For the test, I want you to touch your hands as many times as you can in a 15-second period. And go. And stop. And you can come down. So you got 26 touches in that 15-second period. What we look for is less than 21 touches may be a high predictive risk of having an upper extremity injury.